My talk today is less about molecular biology, although that's probably the biggest field that's coming now, and more about preventive strategies that maybe can help ourselves, but perhaps more importantly, help the next generation. Those of you that I know personally know that I got babies sick. I have these two children, late in life, obviously. One's 4. One's 18 months. How old is she, Marion? Yeah, 18 months. And so it makes you think for a while about not just what I do for a living, because until 4 o'clock this morning I was taking care of a really sick patient with a bad heart, but why I do it and what we live about. And so I want to talk a little bit about a change of heart, about transforming ourselves, about transforming our families, our communities, our children, so that sometime in the future we'll be celebrating prevented disease, disease averted, health, life, and a life-giving sustenance that we can revel in rather than worry about the scourge of disease. I want to talk for just a minute about transformation in an age of hope. I think this is a spectacular picture. It's a red maple. It's obviously late in the season, and I want to tell you about a very important thing that happened to me in my life. My wife and children were gone. It was early in the morning, and I was taking a shower, and we have this kind of shower like everybody else has. You can't hear anything, and so I get out of the shower, and I look up, and there's an intruder in my house. I'm going to walk around a little bit. So there's an intruder in my house. And I look at him. I didn't know he was there, and I don't know what the world he's doing there. And it turns out I look at him, and you do this quick inventory. Like, does he do me harm? Is he aiming to hurt me? Is he going to kill me? Is he here to steal from me? And I thought very quickly as I identified him, he's kind of this fat, balding guy, and he's kind of wimpy. And I know that I can kick his living country. It was me in the mirror. And I said, it's time for a transformation. Ever happen to you guys? My sense of myself is I'm 35 years old and finishing training and excited about the potential, hi Holly, potential in my life about what my future's about. And now I stop in mid-age and say, but you know, my past is perhaps as fruitful as my future might be. What can we do? What we can do is we can take better care of ourselves. Many of us have had moments in our lives, not just about health, obviously. Throw that fat, balding guy out, Marion. But about pivotal points where we make decisions, where we take some thought, some advice we might give to our children. What would you do? What would you do differently? What advice do we have for our children and the next generation? And that is, clearly we say, do what makes you happy. How many times have you heard the advice to the graduating seniors of whatever class, which is to say, find something you like to do and see if you can't get paid for it. It's about following your heart. And for us, involved in heart, for us who have family members who may be afflicted with heart disease, who have a heart disease ourselves, it's about following our hearts. And there are these great parallels. Now, cardiovascular disease is an incredible hodgepodge of things, and we've heard a lot about it, and I'm sure some of the breakout sessions, I was sorry to have missed Kurt Horton's talk, but there are breakout sessions detailing some more of the specifics, and I'll have some of those pieces in there about the science and molecular biology, perhaps, the things that we ought to know, probably do know. If we don't know, we'll brush up on it. But they include hardening of the arteries, stroke, heart attack, high blood pressure, diabetes, metabolic syndrome, obesity, fat, blah, 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 blah. And they are, in sum total, the #1 killer of Americans. But worse than that, it's the #1 risk grouping of things that hurt our lives, that detract from our ability to be healthy, to be healthful, to be happy, and live to our entire potential. What it means to be free of heart disease isn't just that you have a healthy heart. It means that you have times for the things that are important to all of us. More life, more love, more family, more hope, and in some cases, more than we can ever dream. This is stolen directly from Robert Frost, and it's about the transient nature of life. In this, it's about the transient nature of the seasons. And so the leaf subsides to leaf. So Eden sank to grief, so dawn goes down to day, and nothing gold can stay. And we're yet not quite so pessimistic or passive about the passing of seasons, that cardiovascular disease is an integral part of our lives and the proximate cause of our deaths. We need a different plan. It's said that the definition of optimism is doing the same thing the same way over and over again and hoping for a different result. That fat guy in my house the other day, that was the same thing. I want you all to know that I ran 3 miles 2 nights ago on the treadmill. So women in cardiovascular death. This has been shared with you today. It's a sobering statistic. All of us are touched by the other important sociologic phenomenon of women and of our time. Breast disease, probably the biggest single competitor for our attention and our money and our investments. And yet this dwarfs that fierce a foe. This dwarfs it. One of the pieces of this talk is that cardiovascular disease is largely, completely preventable. That it can be prevented even after it occurs. That if you're unlucky enough to have your awakening, to have your transformation, to have your change of heart late in life, there's still hope. It can be effectively treated even in its most severe forms, and it requires that we transform ourselves. This is a sobering statistic about the current cardiovascular mortality. It is blind, it is cruel, it is so far inexorable, and that 45% of every woman in this room, stand up, count off by ones and twos, and the number ones will die of cardiovascular death unless we change it. Everybody's at risk. The beautiful Getty's picture, I think you can see it. That child in her sweater is at risk every bit as much as anybody sitting in this room. Heart disease kills 6 times as many women as breast cancer, and 25% of American women have cardiovascular disease, and women arrive later in the course of heart attack for therapy than men and die at a rate that is 50% higher. There are many, many reasons to avoid heart disease, especially if you're a woman. The mortality of heart disease in the year following the first heart attack is double that in women than it is in men. Double. Keying the importance of prevention. If we were to script our lives, would we not script it that we would enjoy health late into the ages? where our minds would be clear right up until the moment that our bodies, perhaps 80 or 100 years old, surrounded by grandchildren or gardens that we've tended or projects that we've worked at. Will we not envision that sort of death for us, passing on to the next generation, a spot that we might have taken for 100 years or more? And yet that's not what the disease is about. That disease is about claiming your life at least 15 years earlier than that, on average, in people who die from cardiovascular disease. And worse than that, it's about stealing the last 15 years, if you're lucky enough to survive your first heart attack. It's interesting, women show up later, you're protected for a while from estrogen. And so estrogens are a protective effect in cardiovascular disease, unless, of course, you have cardiovascular disease, in which case it's a lethal component. If you look here, premenopausal risk of coronary disease is pretty low, probably protective effect of estrogens. But once you get older than age 60, and I've seen one woman in this room who is older than 60, maybe not, the risk is the same, no change. And yet how you present to the medical establishment is quite different than a 60-year-old man. A 60-year-old woman walks into the emergency room with chest pain and she has what? Name it. Anxiety, reflux. 36 years of longitudinal data from Framingham, Massachusetts tells us women have more angina, but less typical presentation. They're diagnosed fully half the time when presenting with myocardial infarction. They have a disproportionate relative risk increase for smoking. And so, we tell men to smoke. We have a little different mindset about women smoking. We think that's relatively the same risk. It's absolutely not. A disproportionate increase in risk for smoking. And the one-year mortality we talked about, this is in Framingham, so there's a little drift in the statistics. Mark Twain says statistics are for liars, but these statistics apply in Framingham, Massachusetts. The 24 and 48 apply for the rest of the country. Still, again, double the mortality in a community that is focused on cardiovascular risk. This is my favorite slide, by the way. So infarction presents in unusual ways. The symptoms of a heart attack in a woman may be more subtle or ignored, and the risk is almost always underappreciated. Like swimming with polar bears, that seems like such a peaceful picture, and yet the danger there is overwhelming. Sylvia Plath would ultimately kill herself, gassed herself in an oven, and this was her warning to the world. She had tried to kill herself, been found by her parents. She wrote the bell jar, and yet she's allowed to go on and kill herself. It is the same for all of the women in this room, that we have risks of heart disease. Some of us have it, and yet we get to go on to let it go to its final expression. This picture is purposefully vague. Maybe if the lights went down just a little bit more, you might be able to see it. It's meant to be a little foggy. It's meant to represent the remembrances of our role models, our spiritual guides, our mothers, our sisters, women that we have loved in our lives who fade from our memory because of cardiovascular disease. Lots of reasons why, as women, you collectively are short-shrifted in medicine. Some of it's your own damn fault. You should be ashamed of yourselves. Wearing red boas, showing up at luncheons, smiling. You're just too damn busy. 25% of women who knew they were having a heart attack, knew it in their bones, delayed. Take care of a few things. like taking care of their family or their children or their husbands. I have a patient who showed up. Many of you heard this story before, and I'll tell it to you quickly. She had terrible chest pain in the morning, awakened in the morning with terrible chest pain. She thought it was anxiety. She'd been told that before. And the pain persisted throughout the day as she clothed and fed her children and her husband. She made his lunch. She went to Safeway, right next to a hospital, within 200 feet of the emergency room, went to Safeway, did her shopping, had terrible chest pain, took a Xanax because she thought it was the anxiety, did the shopping, got back in the minivan, took another Xanax because it was so painful, went back out to the mill, took her husband lunch, went back home, made dinner, and then at dinner, when everybody was seated and the food was presentable, somebody looked at her and said, "You look terrible, you should go to the doctor." She'd been having a heart attack all day long, and yet what she took care of was she listened to the voices that had told her it was anxiety. She took care of her family, and she lost half of the pumping efficiency of her heart. She would later go on to drop dead, dancing at a wedding, be revived, and have an implanted defibrillator. She's alive again, still alive, but she is so much the worse for wear. So much the worse for wear, and it's preventable. So once diagnosed, awareness is not enough. That we come to these meetings, that we come to these luncheons, it's not enough. Because once you get into my realm, you're still less likely to get primary intervention. You're still less likely to get primary therapies, and you are still less likely to survive. And if you are allowed to have your first heart attack, remember, your mortality in the year following is twice that of our male counterparts. These are the cardiovascular mortality trends for males and females. This is 1993 data. The trends are no different today. This is women. This is men. They're both parallel. You can see that the relative rates for women are much higher for men than men. We talked a little bit about that. There's a scientific molecular-based reason why you're dying faster. It's not all insensitive heart surgeons. Well, no. When you get to heart surgery, which is what I do, 30% of all bypass procedures performed on women. The perioperative complications and death following heart surgery are more common in women. It's a more difficult operation for a lot of anatomic reasons. But the benefits of surgery, despite the higher risk, confer equally to women as to men. And in fact, the Society of Thoracic Surgeons has recently issued new guidelines specifically pertaining to heart surgery in women. We're starting to get the message. You knew this. Your husbands and boyfriends and brothers know it too. Would you like to know how I know? More comorbidities. That means you're not quite as healthy when you get to us. Probably because you end up taking care of your family rather than yourselves. More metabolic syndrome. This is a relatively newly appreciated basket in which many of us fit. Smaller blood vessels. More untreated isolated systolic hypertension. Very interesting. When I was in medical school and in my early training and residency, isolated systolic hypertension of the elderly was a separate diagnostic category. It was to be ignored. We've learned since that that's not true. And isolated systolic hypertension should be aggressively treated, especially in women. So there's some benefit to ongoing research and understanding. Now, risk factors, we all sort of know these. This is one, this is kind of a weird one. Metabolic biochemical marker, elevated CRP, that's the reactive protein, a measurement for systemic inflammation. Probably more important in women than it is in men for some reason. Central obesity, this is that fat guy in the mirror. This is the guy that, the person that we look at when we look at our distribution of body weight. That's genetic. that piece where we have central obesity, meaning that I don't even, and I never get it quite right. You're either an apple or a pear, and I kind of forget which ones you are. It's the people who have big bodies and skinny legs. You say, well, why is that so? I mean, it seems like this funny observation. Oh, that person gets heart disease, that one doesn't. There's a pear, there's a guava nut or something, I don't know. I have problems with my analogies. But it's not that we're fat. It's that the fat cells in our abdomen make a molecule, interleukin-6. So far as I know, interleukin-6 sole objective is to make your blood vessels mad. It is created at a rate that's related to the amount of abdominal fat and almost nothing more. That's not quite true, but I'll oversimplify it. And if you lose that tummy fat, you lose interleukin-6. If you lose interleukin-6, CRP levels go down. If your interleukin-6 levels are low and your CRP levels are low and you are skinny, you not only look great in a pair of lucky jeans, you have less heart disease, which is kind of a bonus. Metabolic syndrome, this is it. I haven't seen anybody in the room that probably has this. Maybe you have a better look than I do. It's a very, very common occurrence, and it is a huge predictor of long-term incidence of cardiovascular disease. So, what do we do? Well, we have recently refined a more national approach to realistic preventive medicine goals in cardiovascular disease. Blood pressure measurements have been, blood pressure means and goals have been rotated downward. Cholesterol levels have been rotated downward. It used to be that if your cholesterol was under 200, you were fine. Now we know that that's not true. And there are very specific subset guidelines for management, which is probably a political compromise. Probably for all of us, cholesterol ought to be at its lowest possible level, but it's expensive, and we make trade-offs as a nation. Treatment of metabolic syndrome, and this is the thing that's most fun and it's most difficult. Metabolic syndrome, not only was it just recently diagnosed in the last dozen years or so, it has made its average age of entry into our society. It used to be about 40, it's now about age 18. 25% of the kids in high schools across the country have at least 2 features of metabolic syndrome. If you imagine the risk for coronary disease or atherosclerotic disease to be the sum total of the risk over the period of time, imagine the harm that's being done to these children's future. And it can be as simple as achieving ideal body weight, getting rid of the rest of the metabolic syndrome. Now, blah, 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 blah. Get over it. Anything of which you are suspicious. This is my favorite. Headache is right next to change in sexual functioning, and I have to talk about this. You would think that I made this slide up and did it on purpose, and I swear to God, I did. When one looks at the subtle symptoms of coronary disease, especially a subtlety in women, they can be just as simple as that. I've had a change in the frequency or severity of headaches. Some people, and I've actually had a person who that was her sole presenting complaint. Actually, that was her husband's sole presenting complaint. That was the marker for knowing that something was different. And it's interesting because it's not quite as purient as we'd like to make it be. If you think about what we do in the patterns of our lives, a person who likes to garden or a person who always likes to walk here or do this or that, it's a measure of their daily activities and exertion. As we grow older and as we become more limited by coronary disease Mr. Mayor, nice to see you, sir. Hi, John. As we grow older and have perhaps less of a grid work to put this suspicion on, sexual activity can be the most vigorous physical activity that a person encounters, and that might be the anginal equivalent. So it's not it's a pretty good joke. It's a little cute, frankly, when a 70-year-old couple comes into your office and says, "We're having trouble having sex." I said, "Geez, you ought to be a 48-year-old guy, get no sex at all." So, who should be concerned? Anybody with two of the above risks. I noted in Community's survey, the 82% seemed high, and I went and looked at it, and they looked at it and said it was at least one of those risk factors, and that is a great screening tool. This piece says two that should have medical attention. It's not in conflict with what the Community survey was. Two of these, you ought to have a medical checkup. Strong family history of early heart attacks, especially in female family members. If your mother had a heart attack before age 60, you ought to be looked at. And any physician that does not share your concern should be re-educated. All of us in the business of trying to give cogent and safe advice to our patients, our community, our families, need periodic re-education. And if your physician, your own doctor, doesn't think you ought to be concerned, help he or she, him or her, to re-educate themselves. Remember, metabolic syndrome is a new disease. Interleukin-6 is a new molecule. Something will happen tomorrow that I left out of this talk today, and I'll need to learn it. Help us help you. So, practically, what can we do? Well, aspirin in low dose seems to be helpful. I'm not telling you guys with ulcer disease to get on it. This is not medical advice. The mayor's here. He heard me say this. That's it. Vitamin E, we don't necessarily promote it, but some people ask. I'm asked all the time, what about vitamin E? Well, it turns out that it does seem to mediate against mortality and heart attack, but doesn't reduce the myocardial infarction rates. So if you're on vitamin E because you think you're going to have a heart attack, good on you. If you're on vitamin E because you think you're going to prevent a heart attack, buy vitamin E from me for cash. This can't be overstated. It's hard to tease out obesity as a fashion faux pas, as a national epidemic, as a pejorative interaction that we have with the modeling and clothing manufacturers of our times, from a significant, real, and important risk factor for not just cardiovascular disease, but for a loss of life expectancy and time, and for enjoyment. And so this is absolutely true. There is a metabolic basis for that. There's a molecular genetics feature of it that is absolutely true. Lean bodies resist coronary artery disease, and if you don't believe it, get to ideal body weight and see what happens. I'll pause so we can all do the math. We talked about tummy fat. And if you want to know your ideal body weight, for most of us, and actually we're the last generation that can do this, remember what you weighed in high school. Just kind of think about it. I was a senior in high school. I weighed, that's probably what you ought to weigh now. And you can do the math. That's a pretty good number. BMI, there's all sorts of tools out there to decide how you're doing. There are charts that'll give you ideal body weight and body mass index. But remember, it's not about fashion, it's about risk. And so it's not just whether I'm a size 16 or a size 14 or a size 2. It's about whether I plan to live to be 100 and be surrounded by great-great-grandchildren when I die free of coronary disease. The other thing that I think that some of us need to be reminded is that it's never too late to begin prevention. There's primary prevention, which is to avoid the onset of the disease entirely. There's secondary prevention, which is to say we're going to address the risk factors that we know we currently have. It is not preordained that if you have risk factors, that you have metabolic syndrome, that you have coronary disease, that does not start a clock ticking down to your next heart attack or your first heart attack. It is totally and completely avoidable in most cases. So prevention is the result of a healthy lifestyle and is very much related to knowing oneself, your own vulnerabilities, and addressing them for life. It's remaking ourselves, it is transforming ourselves, and it is the single strongest weapon in the fight against cardiovascular disease. All of us, after remaking ourselves, need to teach and help to transform the next generation. We need to reprogram our current risks that exist within ourselves, in our communities, and our environments. We need to treat and reduce risk factors, and we need to plan for a change of heart. And prevention transforms our families, ourselves, our communities. Thank you.